The next is the measles. Measles, it is also known as rubeola. So other name of measles, remember, the other name of measles is rubeola. That means the red spot. So it is a contagious viral infection that is caused by which virus? Measles virus. So it primarily affect the respiratory system and can lead to distinguished rash. So it is caused by RNA paramyxovirus. So what could be the transmission? The measles, it spreads through the respiratory droplets. So when an infected person coughs or sneezes, it can be transmitted by direct contact with the infected surfaces. So the infected materials are the secretion of nose, throat and respiratory tract of the individual. So what are the symptoms of measles? The symptoms. What are the symptoms of the measles? The measles typically begin with the fever. So remember the 3C. That is coryza, that is runny nose. Second, remember the 3C, coryza, cough, coryza, cough, and the conjunctivitis. So remember the 3C, coryza, runny nose, cough and the conjunctivitis. Along with that you will see the Koplik spots. These are the small white spots. So these are the Koplik spots that are present on the buccal mucosa. These are the small white spots with the red border that may appear inside the mouth. Typically, a few days after the initial symptom, a red rash appears on the face and spreads to the rest of body. So this rash would last about a week. So in eruptive phase, you will see a maculopapular rash behind the ears and spreads in a few hours over the face, neck and extend throughout the body. The lesion and fever, it disappears in 3 to 4 days. So post measles stage, you will see weight loss, weakness, deterioration into chronic illness. It may cause growth retardation, diarrhea or other infection. What are the complications that could be associated? The complication can be seen in a young individual and those with a weak immune system. The complication includes pneumonia, encephalitis and rarely death. So remember, measles, it usually spreads in the late winter. It spreads in the late winter period. The virus can cause significant enlargement of the lymph tissues, including the lymph nodes, tonsils, adenoid, and Peyer's patches. So oral manifestation, remember the Koplik spots. These are the specific oral signs of measles, but other oral tissues like candidiasis, NUG can occur in malnourished children. So the prevention is vaccination. It is the key to prevent the measles. The measles vaccine, it is included in the MMR vaccine and it is highly effective. Now on histopath you will see the Initially, you can see the cobalic spots. These are the area of the thickened epithelium, and they show fluid-filled spaces between them and abnormal cells maturation. Along with that, you will see a giant cells. Over time, these cobalic spots will mature, the epithelium undergo neutrophilic exocytosis that can lead to microabscess, epithelial necrosis and ulceration. Along with that, you could see this is the Warthin Finkelday giant cells. The hyperplastic lymphoid tissue that contains numerous multinucleated giant lymphocytes are known as Warthin Finkelday giant cells. So initially they were thought to be specific for measles. Remember, for your exam point of view, similar cells they have been seen in Kimura disease and lupus erythematosus. The next is the Rubella virus. It is also known as German measles. So it is a contagious viral infection that is caused by Rubella virus. So it is generally a mild illness but can have a serious consequence if contracted by the pregnant woman, as it can lead to congenital rubella syndrome in the unborn babies. So it belongs to Togaviridae family. So the incubation period is around 2 to 3 weeks. The incubation period is around 2 to 3 weeks. So many cases of rubella, the symptoms generally starts with low grade fever, a rash that appears on the face and spreads to the rest of body, swollen lymph nodes behind the ear, mild cold like symptoms like runny or stuffy nose could be seen. There may be tender lymph nodes, etc. The rash usually starts on the face and the neck region, and it spreads to the body within a day and fades with the desquamation. It is usually resolved by day 3. So orally you can see this is known as orally you can see oral lesions that are seen on the face. They are known as for shimmer spots or for shimmer sign that is seen on the soft palate in case of rubella. The complication includes the arthritis, encephalitis, congenital rubella syndrome if pregnant women are infected. So what is the impact on the pregnancy? The congenital rubella syndrome, the greatest concern with rubella is its impact on the pregnant woman. If a pregnant woman contracts rubella in the first trimester, it can affect the developing fetus and cause loss of pregnancy or stillbirth or severe damage to the developing fetus, causing eye problems, hearing problems, and the heart damage. Now, how can you diagnose rubella? Rubella is usually mild and specific treatment is not required. Laboratory tests, they are necessary due to often mild or non-specific clinical presentation. The serological analysis, virus culture, PCR are used for diagnosis. The detection of IgM, the presence of specific IgM antibody indicates recent rubella infection. The persistence of IgG antibodies beyond 6 months or demonstration of IgM antibody, it is the diagnostic for congenital rubella infection. The rubella is generally mild and specific treatment is not required. Antipyretic drugs can be used for the sympathetic relief. The vaccination is crucial for prevention. MMR or MMRV are recommended for children and non-pregnant women of childbearing age. The contraindication for vaccine includes the pregnancy, immunodeficiency, allergy to vaccine components, and febrile illness. So complication, if a pregnant, it can lead to CRS syndrome or congenital rubella syndrome that can cause birth defect, deafness, heart defects, cataracts in the children. MMR vaccine that consists of measles, mumps and rubella is highly effective in preventing rubella. It is given in 2 days, in 2 doses. The first dose is given at around 12 to 15 months and the second dose is given at the age of 4 to 6 years.